Sexual and reproductive health and rights means having control over our bodies, choosing when and if to start a family, and being protected from sexually transmitted infections like HIV. But these rights are not always guaranteed. Programs like Together for SRHR are working to change that reality. Since 2018, the program has contributed to the health and well-being of 640 million people. Combining efforts of UNAIDS, UNFPA, UNICEF and WHO. The program supports new policies and legislation, expands and improves access to integrated SRHR services, and empowers communities and young people. The program works with the East African community and the Southern African Development Community to harmonize efforts and track progress against the Sustainable Development Goals. Through program efforts, 10 national laws have passed that increase sexual and reproductive health and rights. Laws in Botswana and Zambia, for example, have expanded access to SRHR services for adolescents and young people, while in Eswatini, Lesotho, and Uganda, stronger laws are better protecting survivors and ensuring that perpetrators of GBV are prosecuted. To increase access to services, 44,704 healthcare workers were trained to deliver people-centered integrated services, including HIV, family planning contraceptives, and gender-based violence response. Countries such as Kenya and South Africa have piloted models to provide such services to key populations, while 13 countries have strengthened the provision of integrated abortion care in accordance with country laws. This has led to increased uptake of services, stronger client healthcare relationships, reduced time spent at facilities, decreased patient load, and improved identification of cases of gender-based violence and cervical cancer. Partnerships with the Universities of Cape Town, KwaZulu-Natal, Edinburgh, and Oxford have analyzed health systems to provide evidence of what works to prevent teen pregnancy and new HIV infections.
In fact, we think they will be freer and also find it easier to go to a health facility or to go to their peers, because the project will be implemented by young people.
Knowing that adolescents and young people respond best to advice from their peers, mentoring programs have led to positive results, including contraceptive uptake, improved mental health conditions, and a reduction in intimate partner violence. One partner, the United Movement, has forged a network of thousands of young people to advance and protect SRHR across 14 countries in the region. These young people are making the voices of thousands of others heard in decision-making spaces by advocating for improved services, increased funding, and changes to laws in their countries. Experience and data show that harmful social, religious, and cultural norms often reinforce patriarchal values. To address this, Together for SRHR works with religious leaders and influencers to engage men and boys in conversations about gender equality, positive masculinity, and SRHR.
In an
evolving environment, climate change, disease outbreaks, humanitarian crises, and more can dramatically increase risks of gender-based violence, HIV transmission, unintended pregnancy, and mental health conditions. In response, Together for SRHR is supporting 22 countries to ensure minimal disruptions to essential SRHR services in emergencies. from increased health services to youth engagement and more. These achievements are a testament to the unique regional partnership that 2gether for SRHR has forged. Together, we are transforming lives in the region. For a one-stop shop of information and resources on sexual and reproductive health and rights in Africa, visit the 2gether for SRHR Knowledge Hub.